Hello, I am a cow, Ushi-Sensei. In this video, we will discuss whether salt restriction is necessary for heart failure patients. I am a Japanese cardiologist. In this channel, I tell you about medicine from the basics. Sorry, but I am not good at English, and please note that this is the content of medical treatment in Japan. Ushi-Sensei is Japanese, and it means cow doctor in English. Heart failure is defined as a clinical syndrome consisting of dyspnea, malaise, swelling, and decreased exercise capacity due to the loss of compensation for cardiac pumping function due to structural and functional abnormalities of the heart. It is important to note that heart failure is a syndrome, not a disease. When treating patients with heart failure, it is important to distinguish the causes of heart failure and the precipitating factors. Precipitating factors of heart failure include the following for gut medicine: arrhythmia and anemia, ischemia and infection, lifestyle including insufficient salt restriction, upregulator, rheumatic, embolism. And from the initial alphabet, we remember them as failure in Japan. Japanese guidelines recommend a salt limit of less than 6 grams. EST guidelines also recommend a salt limit of less than 6 grams. On the other hand, ACCF guidelines recommend a salt limit of less than 3 grams in patients with stage C or D heart failure. In cases of severe heart failure, further salt restriction may be recommended in Japan. However, there is no clear evidence for salt restriction. Excess salt causes fluid retention, and it can exacerbate heart failure. However, excessive salt reduction may increase the RAS impedance with severe renal failure. It is because excessive salt reduction could decrease renal blood flow and constrict export arterioles. If the patient had hyponatremia, blood sodium levels would be further exacerbated. Hyponatremia is an independent poor prognostic factor in heart failure, so Baftan would be used for such patients. In my experience, remembering to take your medication is much more important than strict salt restrictions. Forgetting to take your medicine is worse, especially in patients in heart failure who are taking diuretics. Forgetting to take the medication is directly related to an exacerbation of heart failure. Another important factor in whether salt should be restricted is the degree of blood pressure. In hypertensive patients, excessive salt can easily elevate blood pressure. Hypertension increases cardiac afterload and can exacerbate heart failure. I think that salt restriction is especially important in heart failure patients with elevated blood pressure. In patients with exacerbation of heart failure, I often experience spontaneous improvement of heart failure after hospitalization without additional treatment. The main problem in such cases is treatment compliance. We imagine that before the patient was admitted to the hospital, they took a lot of salt. In addition, in patients who cannot limit salt intake, they may forget to take their medications. This also causes elevated blood pressure. I have a feel that I have a feeling that salt is not the only problem in these cases. Here are some important matters regarding salt restriction. First, salt restrictions can induce slow nutrition. Patients tend to eat less when foods are offered with little flavor or when dietary restrictions are too strict. Malnutrition is a poor prognostic factor in heart failure. Excessive salt restrictions in malnourished patients may in fact have a negative effect on heart failure. Second, discussing whether to limit salt. It is important to know what causes heart failure. For example, if taxable cardiomyopathy is present, it will improve spontaneously after the heart is healed. I don't think there is any need to be overly concerned. On the other hand, if the patient's heart failure is caused by hypertension, then blood pressure control is important and salt restrictions is extremely important. There is one problem here. It is very difficult to know the exact daily salt intake. Let me explain what I think. First, a diet that limits salt intake to less than 6 grams per day is offered beginning with the acute phase of heart failure. Once the heart failure condition is stabilized, we usually perform nutritional guidance including salt restriction, less than 6 grams per day. I also believe it is important to have them compare the intensity or the taste of the meals at home with intensity or the taste of hospital meals. If the food at home seems more flavorful than the food at home hospitals, I would suggest that home meals would be unflavorful as the hospital meals. In case of heart failure, it is undesirable not to restrict salt intake. In addition, I think we should examine whether the following items apply: frailty, malnutrition, hypertension, reversible cause of heart failure. Salt restriction in patients with frailty can lead to further malnutrition. We do not believe that patients with low blood pressure benefit as much from salt reduction as those with high blood pressure. If the cause of heart failure is reversible, then lifestyle guidance is needed while watching the condition. And if there are many interventions that need to be done with the patient, then we should not stick to salt only, but should do a comprehensive heart failure management. In conclusion, salt restriction is important in heart failure patients, but its severity should be determined on an individual case basis. In summary, there is no clear evidence for salt restriction, but appropriate salt intake is necessary. If the patient has hypertension, strict salt restrictions are even more important. However, less significant when blood sodium levels are low. It is important to pay attention to nutritional status as well as salt intake. Thank you for your visit and watching my movie. See you.